Okay, I feel like we're good to start. There's a Zoom update happening, so I wanted to give everybody a few minutes to get in. But on behalf of Screen and J and Rutgers Cancer Institute, hello and welcome to Community Cares and Project Echo. Thank you so much for joining today's session, and we hope that the information shared today will help you serve your community better. And before we begin, I just have a few announcements. So today's agenda, we're going to do a Project Echo series overview, introductions, the actual presentation, and I think a case study. And at the end, we'll do questions and answers. So a little bit about Project Echo. The Rutgers Cancer Institute became a Project Echo hub in 2021. Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The ECHO model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. And this is done by using technology to leverage scarce resources. So, from sharing best practices to reduce disparities, to applying case based learning to master complexity, and evaluating and monitoring outcomes. So, for more information about Project ECHO, you can visit echo.unm.edu. And now for our speakers. So our first speaker is Brittany Cocherio, and she is a physical therapist and clinical manager at Kessler Rehabilitation Center in Northern New Jersey. She is a certified lymphedema therapist through the Norton School of Lymphatic Therapy and a Revital certified specialist through Revital Cancer Rehabilitation within Select Medical. Brittany is a faculty member with Revital Cancer Rehab. She has been a guest lecturer at Ithaca College on breast cancer rehabilitation, at Hampton University on the introduction of lymphedema. She's a prior presenter at APTA CSM in 2025, presenting on the oncology section on the topic of cognition and fall risk. Brittany graduated from Ithaca College with her doctorate of physical therapy in 2016. Marianne LeBlanc is an occupational therapist at Kessler Rehabilitation Center in Northern New Jersey. She is a certified lymphedema therapist through the Norton School of Lymphatic Therapy and a Revital certified therapist through Revital Cancer Rehabilitation within Select Medical. She's been a guest lecturer at Hampton University on the introduction to lymphedema. She's a prior presenter at ACRM 2019, presenting on the Less Squeeze, More Hold lymphedema garments. Marianne graduated from Seton University with her master's in occupational therapy in 2016. So I guess I'll pass it to Brittany and Marianne.
All right, everyone. Mary and I are really excited to talk to you guys today about the topic of cancer-related lymphedema. So cancer is a journey. No path is the same. Everyone starts in a different place. So your age, your beliefs, your support system of family and friends, your general health or well-being, among other factors that contribute to where you are at the beginning. Your destination may also be different. Where are you going? Is your destination finishing treatment and putting cancer behind you? Is it living with a chronic condition, managing side effects to lead as normal and independent life as possible? Your destination is determined by the goals set between you and your medical team. Once diagnosed with cancer, your path may take you through different treatment choices, including surgery, chemotherapy, targeted therapy, radiation, which are all customized by your cancer team to meet your needs and get you to your destination. With specialized treatment, each person's side effects and intensity of side effects will vary as well. The tolerance to treatment will be impacted by your general well-being and where you started at diagnosis. Our team wants to help you keep your motor running smoothly throughout your experience to your destination. Before we talk about lymphedema, which is a dysfunction of the lymphatic system, we first need to understand a little bit about the lymphatic system. We are all born with a lymphatic system. It is vital to our immune system and allows us to fight infections by ridding our bodies of toxins and promotes fluid balance in our tissues. But how does it do it? The human body is composed of two circulatory systems, one that carries the blood through the body in a circular fashion from the heart to the arteries to capillaries to veins back to the heart. The other is the lymphatic system, which carries the protein-rich lymphatic fluid. It is responsible for returning the fluid out of your tissues and back to the heart. Once this fluid returns to the heart, it moves on to the kidneys and is removed as urine. The lymphatic system is throughout the body, both on the surface and deep within our spine and organs. On the surface, the superficial system is divided into territories or regions. The regions have division lines known as watersheds down the midline and around your abdomen at the level of your belly button. When your body moves fluid through the superficial system, it doesn't normally cross and therefore dictates what area of the body a group of lymph nodes helps filter toxins, waste, and unneeded material. This is why when lymph nodes are removed, we know which part of the body to monitor for changes. For example, for a person with breast cancer, they have lymph nodes removed in their right armpit, so we would monitor their right chest, back, and arm for changes in swelling. So what is cancer-related lymphedema? It is an accumulation of fluid in fibroadipose tissue due to the destruction of lymphatic flow from cancer and its treatments. Let's break that down. An accumulation is a buildup of more fluid than is typically in that area. Lymphatic fluid is thicker than water. The toxins, waste, and unneeded material clump together and over time create fibroadipose tissue. Fibro, as in fibers, cause a thick network, and adipose meaning fat. This makes it more difficult for the lymph fluid to move through the vessels, through circulation, and back to the heart. When a person undergoes cancer treatments, they can have a change to their lymphatic system through surgery or radiation, making it more difficult for the body to move lymphatic fluid. These factors, along with obesity, injury, and infection, can result in the destruction or reduced movement of lymphatic fluid, allowing it to build in the tissue, as you see in this person's arm and leg. It's important to know that this doesn't happen overnight. Small changes in the lymphatic system function build with time. If you experience a sudden change in swelling, contact your doctor immediately, as this is not lymphedema and you should seek medical attention. It's important to remember that not all swelling equals lymphedema. You can have edema or swelling related to venous system problems, water retention, arthritis, organ problems with the heart or kidney, medication, lipedema, or an acute injury like an ankle sprain that would result in general edema, but not lymphedema. Many think of breast cancer when they think lymphedema, but really it can occur with any diagnosis in which the lymphatic system has been impacted. Additional cancers that are more common to have lymphedema as a side effect include melanoma, bladder, sarcoma, uterine, head and neck, cervical, vulvar, and prostate. These types of cancers have some commonalities in their treatment that make patients at an increased risk for developing lymphedema. These are known as risk factors. There are 4 major risk factors for developing cancer-related lymphedema. 2 related to cancer treatment include removing or damaging lymph nodes and the late effects of radiation, which cannot be avoided. Risk factors such as maintaining a healthy weight, so a BMI of less than 25, and working with a cancer rehab therapist or specialized exercise physiologist on a comprehensive dosed exercise program, including aerobic, stretching, and strengthening components, are excellent ways to reduce immediate and long-term risk for developing lymphedema. Although infection and injury cannot be necessarily avoided, there should be extra caution if these events should arise. So what might you notice? Changes in fit of your clothing, shoes, or jewelry. You may feel that a part of your body is visibly larger than normal. Tightness in joints, stiffness with movement, puffiness, or feelings of fullness. Changes in skin texture. Sensory changes such as burning or itching. Let's look at further defining the stages of lymphedema, starting with stage 0 and 1. We will look at stage 2 and 3 in a little bit. Stage 0 is subclinical lymphedema. The concern is for impaired lymph flow the concern is for impaired lymph flow. Stage 1 is spontaneously reversible and typically marked by pitting edema, increase in limb size, and heaviness. Working with individuals who may be experiencing stage 0 and stage 1 lymphedema is generally considered to be most ideal, as they will most likely see their symptoms reversed. We typically think of stage 0 as subclinical Despite not a lot of outward signs of lymphedema, the lymphatic system is impaired and subtle changes can be occurring. These individuals may start to notice heaviness or achiness. Stage 1 is where swelling is typically first observed. This swelling may not contribute to an overall volume when comparing to the opposite side, and often the individual may feel that the swelling improves with rest and elevation.
So taking a closer look at the stage 0 lymphedema. The American Physical Therapy Association, Academy on Oncology Physical Therapy, looked at all of the research related to breast cancer-related lymphedema and found that early identification of subclinical lymphedema in high-risk groups have a better outcome. This is best done through prospective surveillance or planned scheduled visits with a healthcare provider during the first few years of their cancer journey. While lymphedema can develop at any time throughout your lifetime, it's more common to develop during the first 3 years following cancer treatment. So this is why prospective surveillance model is recommended during those years so that we're able to closely monitor those that are at risk for the development of lymphedema. Other treatments include education to known risk reduction strategies, which we'll talk a little bit more about later on. Be able to perform self-massage, wearing compression garments if it's determined that it is appropriate. And lastly, one of the most effective ways to treat all stages of lymphedema is through exercise. Exercise, both aerobic and strength training, are beneficial to reduce the risk of development of lymphedema and decrease the risk of lymphedema on daily activities. You should start using weights low and progress that weight tolerance slow. A cancer rehab therapist is a great person that can help establish an exercise program because they have the tools to understand how the cancer treatment can be affecting that individual. When we look to stage 1 lymphedema, you're going to see here in this picture a person with lower body stage 1 lymphedema and a person with upper extremity lymphedema. It's important to know that it could be part of the whole limb or just one part of it. So as you can see in this woman's arm, it's affecting the arm, but it's less involved in her hand. It could also be the reverse. So you could see someone that has a more involved hand and a less involved arm. Since it's based on the region of the body, it could also involve the chest or it could involve the back. If early signs or symptoms of lymphedema are noted, so this onset of swelling is noted, the patient should be individually fitted with a compression garment, instructed in an exercise program, and provided with education on treatment and risk reduction procedures. If someone's experiencing stage 1 lymphedema, they should seek treatment from a specialist to reduce risk of advancing that disease progression. When we talk about exercise to manage lymphedema, it's going to be prescribed and monitored by a therapist because it could be beneficial to monitor those symptoms closely. Exercise allows muscles to act like a pump and drain any excess fluid that might be developed in the limb. So it's a myth that exercise and strength training increase the risk of development of lymphedema. Rather, it allows for increased range of motion after surgery, improved overall strength, and weight management, all of which are contributing factors to the development of lymphedema and would have a positive impact on reducing the risk for development of lymphedema. When we talk about the more advanced stages of lymphedema, we're talking about stage 2 and stage 3. With stage 2 lymphedema, this is the beginning of a more advanced chronic swelling. The swelling is now going to be consistent and the tissue may begin to change in texture. And this is going to be notably worse swelling for the patient. So the main characteristic of that stage 2 lymphedema is the swelling is going to persist even if there's elevation. So as the person advances throughout their day, swelling is going to persist throughout that arm or leg. The symptoms are progressive and irreversible, but they're still able to be managed. So this is going to require a more extensive treatment plan to manage both acute and long-term. And the type of treatment is what we call complete decongestive therapy. And that's prescribed by a certified lymphedema therapist. Stage 3 is the most progressive form of the disease, and it's noted by tissue thickening, presence of skin folds, or something we call lobules, color changes, and difference in skin texture. The key with stage 3 is that you're outside of just of lymphatic disease, and it's now impacting the integumentary system, so it's also a skin disease. So if we look at these pictures of the more advanced stage 2 and stage 3 lymphedema, we want to think, how can this be impacting someone's function, right? With the significant amount of swelling and changes in limb size. So if we look at the woman kind of on the far right with the swelling in her legs, we can see that her left leg is much larger than her right leg. This can impact her joints, her ability to walk, her ability to wear certain clothes, and change positions while getting dressed or even while doing bed mobility. So at the time of this picture, she had had lymphedema for 40 years. So it was really impacting kind of all aspects of her life. Walking, chasing after children, sitting on the floor. So she had to really have an adaptive lifestyle because of the advancement of her lymphedema. And her stage of lymphedema at that stage 3 really requires daily management to keep her limb healthy and safe. When we look at the treatment of stage 2 and stage 3 lymphedema, we're now going outside of just seeking information from a therapist, and we need to go further than that and receive complete decongestive therapy, which is performed by a certified lymphedema therapist. This is a therapist that's had advanced training in lymphedema and the effects of lymphedema and how to manage that appropriately. So through complete decongestive therapy, we're going to do decongestive exercise, which it's certain active range of motion exercises that's going to help stimulate the lymphatic system to move fluid back into the more proximal part of our body. We're going to participate in skincare. So this is the same type of skincare that we would start working on in stage 1 lymphedema. We're going to monitor if there's any cuts or nicks to the limb, and we're also going to be using certain lotions that are have a good pH balance, so fragrance-free lotions to not cause increased irritation to the limb. We're going to do manual lymphatic drainage. So that's a light touch massage that's going to move lymphatic fluid from the impaired limb back towards the non-affected areas of the body. We're going to do multi-layer bandaging, which this is a form of bandaging using short stretch cotton bandages and foam to promote limb size reduction and increase lymphatic flow back to the body. It's important to note too, when we're thinking about therapists and cancer rehab therapists, that not all cancer rehab therapists are certified lymphedema therapists, but cancer rehab therapists are able to help diagnose these earlier signs and symptoms and help make referrals to the appropriate therapists at that time. So talking about risk reduction practices, we want to have early detection. So that's why prospective surveillance or planned monitoring is very important for these patients, because it's going to help detect these subclinical stage 0 and stage 1 lymphedemas and allow to provide more aggressive treatment early on to make sure it's not advancing to more advanced stage 2, stage 3 treatments where these are really impacting the person's daily life. We want to participate in meticulous and good skincare to reduce the risk of development of infection. People with lymphedema or at risk for lymphedema are at a higher risk for cellulitis infections, which are characterized by warmth to the touch, redness, and an onset of a fever, and can become a more systemic infection. If you get a scratch, a cut, or injury to the area, you want to really clean that immediately and provide a bandage to prevent infection. If you're going to be outside or in the sun, you want to use bug spray or sunscreen just to protect our skin. And you want to keep your nails clean. That way, if you scratch yourself or something, that it's not going to provide increased bacteria to the arm or limb, and avoid any sort of cracks. Maintaining a healthy lifestyle is a risk reduction procedure because a higher body mass than 25 increases your risk for developmental lymphedema. So keeping an active lifestyle and a normal weight are critical. We want to be involved in not only aerobic exercise, but strength training to help the risk of developing lymphedema or worsening lymphedema. If you have a known lymphedema, you want to be wearing compression garments, and that's going to be determined by your healthcare team. And the last risk reduction is participating in those regular medical checkups and reporting any changes of your at-risk area to your cancer care team. This will give early detection and help provide you with early treatment for decreasing the risk of lymphatic swelling. And just as a side note, it's important to note that recent research does not indicate a greater risk of developing lymphedema as the result of air travel, blood pressure, cuff readings, blood draws, and exercise using heavy weights. So when can you see a cancer rehab therapist? Now that you know more about the lymphatic system, cancer-related lymphedema and treatment, when is it an important time to see a cancer rehab therapist? And the answer really is anytime, right? So therapists can evaluate your risk for development of lymphedema, build a specific exercise plan and strategies to build a healthy lifestyle and habits. But you can also be seen by a cancer rehab therapist if there is the development of symptoms. So stiffness and decreased flexibility in the joints, clothing fitting differently, increased swelling after surgery, and this would be more of a 6 to 8 weeks. And any sort of onset of feeling of heaviness, achiness, or fullness in the affected area. So cancer rehab therapists can really help along this continuum of care to evaluate, make a plan, or if there's an onset of symptoms. But the main takeaway is that early diagnosis and treatment is going to more effectively reduce the risk of swelling and the impact of that swelling on your daily life.
Okay. So we're going to dive into a few case studies now of patients that Marianne and I have worked with. So first, let's meet Amy. Amy is a 40-year-old female who presents to outpatient physical therapy with axillary cording, pain in her axilla, trunk, and breast, and decreased shoulder range of motion. And her goals are to decrease her symptoms and be able to return to her Peloton workouts. Let's take a look at Amy's timeline. So on February 16th, 2024, she was diagnosed with stage 3 ER/PR positive, HER2 negative, infiltrating lobular carcinoma of the left breast. So for us as cancer rehab clinicians, it's important to know what stage the patient presenting to us is at, and also what hormones are positive or negative, because that gives us a good understanding of what their treatments are going to look at, and what her next course is going to look at for us. On March 27th, 2024, she underwent a left mastectomy with axillary lymph node dissection. So she had 24 lymph nodes that were removed, and 20 of those were positive. And she had tissue expander placement as well. Then on April 19th, 2024, she had her chemo port placed on the right side. From April 24th, 2024 to September 23rd, 2024, she was scheduled for chemotherapy. So she had 4 rounds of AC, which is adriamycin and cyclophosphamide, and 12 rounds of T-Taxol. Now, in that time, so a few months into her chemotherapy is when she started to notice these impairments. She spoke with her oncologist, and they were the ones who referred her to cancer rehab. So on August 26, 2024, she started outpatient PT. Then, about a month into our treatments, she began her radiation. So her radiation started about a week after her chemotherapy ended. She had that kind of 1 week break, and she completed radiation session 1 of 30 on September 30th. At her initial evaluation, we see her hand grip strength on the left is less than 44 pounds, which is indicative of an increased risk of frailty and functional decline. So any of our cancer rehab patients who are coming in, regardless if their impairments are in the upper extremity, we always test for hand grip strength because it is an indicator of that global weakness, of functional decline, of frailty. So it's a really important way for us to be able to monitor that global strength. When we look at her limb volume, we see that it actually looks really good right now. So she's looking at a 2.3% limb difference, which would not be indicative of lymphedema. Typically for us, we're looking for about a 5% limb difference, and that would be our sign that there could be some lymphedema present, and then we would begin any lymphedema treatment. We do see that she has significant range of motion deficits in her left shoulder, which is affecting her performance of ADLs and functional tasks, and it's limiting her from being able to return to her prior level of function and also being able to return to those Peloton classes that were important for her. So let's jump ahead 2 weeks later. So Amy has now completed 12 of her 30 radiation treatments, and she's been demonstrating improvements with the cording, pain, and shoulder range of motion. And she's also been consistent with performing her home exercise program, which is awesome. But now she presents to her PT session reporting increased swelling and heaviness in her left arm. So we see that her volume increased. So we see that change from 1,705.66 milliliters to 1,773.88 milliliters. So we know she already had that small percent difference at initial evaluation. So upon rechecking, she's now showing about a 6% difference in limb volume, which is higher than that 5% benchmark and would be indicative of early stage 1 lymphedema. So what do? We treat it, right? So she now is presenting with lymphedema, and it's awesome that we were already seeing her when it started because, like Marianne mentioned, being able to catch it early is really going to be your best indication for a really positive outcome. So we're going to initiate manual lymphatic drainage, which is that gentle manual technique used to encourage the natural drainage of lymphatic fluid, and decongestive exercises, which help to activate the muscle pump system to assist with the drainage of lymphatic fluid. We instruct and educate Amy on performing self-MLD, so giving her verbal cueing and handouts and showing her exactly what she can do at home. And we also review lymphedema, what exactly it is, and the risk reduction strategies. So exactly what Marianne was speaking about, we're going to have that discussion with Amy as well. We're also going to discuss the options for compression garments. So right now, because Amy is falling into that stage 1 category, we're going to measure her for ready-to-wear compression sleeve, glove, and gauntlet. So what that means is it's not custom fit for Amy, but it comes in a range of sizes. So we're going to find the one that works best for her. And then we're going to get her a glove, which is going to be covering all of the fingers. So if anyone has seen a compression garment, that's going to be the one that covers all the way up to the fingers, whereas the gauntlet is going to stop right before the fingers. So 1 month later, Amy's limb volume has reduced. She is consistent with performing self-MLD and decongestive exercises 2 to 3 times per week, in addition to wearing her ready-to-wear compression garments daily. She's also continuing to attend her PT sessions. So we are focusing on not only the lymphedema and the manual lymphatic drainage, but also on continuing to decrease her cording and pain and increasing her shoulder range of motion and strength and improving overall her left arm function. But we need to, circle back. So what about Amy's goals, right? She's achieved her goal to decrease her symptoms. Her symptoms are gone. She's doing really well, but she hasn't returned to her Peloton workouts because she's worried about her swelling returning, which is a very common fear and something that we see in almost all of our lymphedema patients. So the question is, how can we help Amy return to working out safely? And the answer is the Strength After Breast Cancer program. So, Strength After Breast Cancer is a comprehensive exercise program that involves a cardio warm up, upper and lower body stretching, and core upper and lower body strengthening that is safe and effective for individuals with lymphedema. So, the SABC program was developed by Dr. Catherine Schmitz through the Physical Activity and Lymphedema trial, which demonstrated the safety and efficacy of weightlifting for breast cancer survivors. So while I think it's a preconceived notion that doing any kind of weightlifting would actually increase lymphedema, those who participated in this study, it actually showed a decrease in lymphedema, decrease in exacerbations, decrease in cellulitis. So we figured out that doing this comprehensive exercise program is actually really effective for patients who have had breast cancer and have undergone treatment for breast cancer. So then getting back to our patient, Amy completed her 5 sessions with the SABC program. Typically, it's about 4 to 5 sessions that would include an education session and then sessions to review the exercises with progressing towards more cueing and direction in the beginning, progressing towards being able to do the exercise program independently. And then over the next 6 months, she continued to progress the weight that she used during the exercises. 1 month after she was discharged, she felt comfortable to begin integrating Peloton classes into her workout routine. And as of now, she's come back for just general check-ins, for region measurements. She's doing fantastic, but she continues to perform the SABC program 2 times a week in addition to her Peloton classes.
So now we're going to talk about another patient, Beth. Brittany and I really wanted to highlight kind of the 2 different types of patients we typically see in this setting. So Beth is a 52-year-old woman with known lymphedema. So she has already been diagnosed with lymphedema, presenting to outpatient occupational therapy with complaints of an increase in left upper extremity swelling, left arm discomfort, and repeated hospitalizations due to cellulitis. And her goals coming into therapy were really to manage her lymphedema and decrease risk for continued infections. So Beth has a pretty comprehensive timeline. So she was initially diagnosed with triple positive carcinoma of the left breast in February of 2021. So between February and August 2021, she underwent neoadjuvant chemotherapy, but she wasn't totally sure of the type at the time of the evaluation. Then after undergoing chemotherapy, she had a lumpectomy at the end of August of 2021 with 6 lymph nodes removed, axillary lymph nodes. So that's already putting her into this higher risk category for the development of lymphedema. In November, and then she received radiation therapy from September to October 2021, 22 sessions. So again, increasing her risk of development of lymphedema throughout throughout the left upper extremity. In November 2021, she had to have a revision through the left breast, and an additional biopsy was done in January of 2022. So we're seeing a lot of different interventions going on, a lot of different treatments for this cancer, right? We had chemotherapy, we had surgery, we had radiation, we had revision surgery, and an additional biopsy. So by March of 2022, she presented to outpatient physical therapy for lymphedema management because she had swelling throughout her left upper extremity. When she first came to therapy, she had a 7.4% limb volume difference between her left and right upper extremity. As Brittany mentioned earlier, anything over a 5% difference is really when we're going to say, okay, there's a clinical lymphedema. So when she first presented, she was in this stage 0 lymphedema where It was swelling, but also going down with elevation and with treatment. So she was seen by physical therapy until June 2022. Her limb volume difference was 3.7%, and she was discharged with one of those ready to wear sleeves, a gauntlet, and a truncal compression bra because she did have some swelling throughout her breast. So fast forward about a year later, August 2023, she ended up being positive in the right axilla for a cancer recurrence. So she underwent a resection and then 3 months of chemotherapy. And at the time of my evaluation in 2025, she was currently on letrozole and Keytruda, which are medications to continue to reduce her risk for recurrence. In December 2023, she had her first cellulitis infection, and that was in the left upper extremity. And she ended up in the hospital for over a week with IV antibiotics. So, with that first cellulitis infection, now we're kind of talking about the stage 3, more progressive lymphedema, because there are skin changes after these cellulitis infections. In June 2024, she had a repeated infection and had to be hospitalized with IV antibiotics again. So from June 2024 to May 2025, she was trying to manage symptoms on her own, but she eventually did return to therapy, not being compliant with wearing any compression, not doing any self-massage, and had no sort of home management for massage. So again, we did the things that, we do want to do on the initial evaluation. We did check her grip strength. Her grip was actually weaker on the right side. This was the side that she had had the more recent recurrence on, but this wasn't Beth's main goal. Her main goal was trying to manage the swelling throughout her left upper extremity and kind of return to a stable state where she wasn't at this reduced or increased risk for continued repeated infections. So at the time of the initial evaluation, she had a 22.3% limb volume difference between the right and the left upper extremity. She also did have discrepancies between her shoulder range of motion. This had been a symptom that she had had continuously from the first time she had received lymphedema treatment, and this wasn't her complaint at the time of returning to therapy. So what happened since she was discharged from therapy in 2022? A lot happened. She had the cancer recurrence on the right side. She experienced 2 cellulitis infections, and she does not have appropriate compression or home program to manage her lymphedema. Also, looking at the size of her left upper extremity from discharge in June 2022 to coming back for therapy in May of 2025, the left arm went up 31%. So that's a really marked swelling. So what can we do? I initiated manual lymphatic drainage with her. We did a new round of multi-layered bandaging. So that's those short stretch bandages. You apply them distal to proximal, so from the hand to the axilla, increasing tension throughout the arm. And when you're seeing someone for this, you want to see them multiple times a week to provide a new application of the bandage with increased tension over time to kind of provide an external force to reduce the size of the limb. And we initiated decongestive exercise, so active range of motion throughout both upper extremities. I instructed Beth and provided new education on self manual lymphatic drainage, so doing massage on herself when the bandages were not applied, and reducing risk for repeated infections, right? So talking about skincare, and if she did have any sort of nick or cut to the arm, to really monitor it very closely and report any changes to the doctor immediately to get on an oral antibiotic so it didn't escalate to this repeated hospitalizations. We discussed concerns for repeated cellulitis infections. So once you have one, you're at higher risk for getting it again. And it does cause permanent tissue changes, which is going to change the size of the lymph volume and not allow for that reduction of size with the compression bandaging. So it's more of providing compression and manual lymphatic drainage to move fluid in and out of the arm. But any sort of changes, permanent changes to the tissue, are now not going to be able to be reduced through therapy. And I referred for an advanced pneumatic compression pump. This is part of a home program for someone with a more advanced lymphedema. It provides, it stimulates the massage that we do in therapy. It's not as customizable because it is a machine, but it stimulates anything proximal on the body. So more of like the armpit, chest wall, and then advances down the arm or leg, and then returning the body to kind of stimulate the massage and return fluid back to the body. And then we discussed options for compression garments because she's now at this more advanced stage needing custom compression size to her arm to make sure that she does not have increased swelling over time. And to do that, we have a garment fitter in our area. Not all areas have garment fitters, but the garment fitters are able to work closely with insurance companies to provide kind of the best sort of financial situation for patients when they have to receive these more advanced custom garments. So she did have some barriers to reduction, these permanent tissue changes from her repeated infection. She also was only able to come 2 times a week to therapy because of her work schedule. And the swelling was on her dominant arm. So her left upper extremity was her dominant extremity. So she was trying to apply these self bandages with her non-dominant arm, which was very difficult. And she also has a very physical job where she was required to kind of go to people's homes and different things. And she had a hard time managing wearing the bandages for up to a day, which is what we recommend when trying to complete her job demands. So 1 month later, she had no significant change in limb volume. So even though we had no significant change in limb volume, this was still like a good outcome of therapy because we were able to give her a really solid home program, right? We had her fitted with compression sleeve and glove and a night garment to allow for continued decongestion of the arm to making sure that the disease is not getting worse over time. She was fitted for a pneumatic compression pump to help give her a more solid home program that made sense with her schedule to simulate manual lymphatic drainage. And she was fitted with new day and night compression bras to assist with more of her truncal and breast edema because over time with these repeated infections, her breasts had also increased in size as well. So talking about her goals, like I said, there was no change in limb volume, but now she has this comprehensive program. She has all the equipment that she needs. And most importantly, she knows that she needs to come back kind of every 6 months, or if there's a change in symptom, for continuous monitoring so that we're trying to catch any sort of disease progression before it gets worse and before it ends up as a systemic infection requiring hospitalization. And here's just some pictures of kind of what her discharge plan is looking like. On the left, you can see that's the more advanced compression pump. So it provides stimulation to the trunk, the more proximal lymph nodes, and then advances down the arm, returning back fluid back to the body. And here's an example of what a compression sleeve looks like. For Beth's case, she would also be wearing a glove with the sleeve to provide compression distal to proximal to make sure that fluid's not accumulating in the hand. So overall, our takeaway is that we really wanted to kind of talk about, the power of cancer rehab and how seeking therapy from a cancer rehab therapist really can help someone along their cancer journey, whether it's to provide education or treatment or dosed exercise. There's a vital role, and it really fits into the cancer care perspective. So Revital Cancer Rehab, so what Brittany and I are a part of, does have a footprint across the United States. We're based out of New Jersey, but we do have clinics and partners throughout the country. And here's kind of highlighting for those in the tri-state area where our cancer rehab programs are in New Jersey. And again, this is Brittany and I, so you can contact us if you have any questions. This provides our email address and our phone numbers to our specific clinics. But then also more globally in New Jersey, and they can assist you kind of reaching out nationally if you have any questions. We have Alina Hendea, she is our Revital Program Director for New Jersey, and Michael Moore, who assists with coordinating scheduling in New Jersey, but he could help definitely schedule out nationally as needed. And just an overall takeaway that, cancer rehab is a vital role in our treatment of these patients. It could provide improvements of quality of life, um, overall function, and really get people back to where they need and want to be to perform the things they need to do, whether it's leisure activities, taking care of your family, work, or even basic ADLs like eating, dressing. This is a vital role in making people live the way they want to live.
Thank you guys. That was an amazing session. I know I learned a ton. Um, I saw that we did get one question in the chat, and I know you guys answered it, but just for anybody who didn't see the chat, if you guys want to answer aloud, Paula asked, what are your thoughts on prehab?
Yeah, so prehab is excellent. I mean, uh, prehab, along with what we're calling prospective surveillance, really allows us as therapists and the patient and the whole cancer care team to have baseline measurements and um, ideas and thoughts on that person's performance and function prior to any treatment so that we're able to closely monitor any changes along the way. So what we're calling prospective surveillance is kind of called prehab in other formats, but it's that, you know, it is a vital role, and the earlier we catch things, the better outcome for the patient, right, and their quality of life. So if someone comes in before any of their treatment and we're able to provide education regarding what could happen and receive any sort of baseline functional measurements, movement, swelling, different things like that, now this person has somebody that they can reach out to if there are any changes, and they're able to be monitored throughout their cancer journey, which is pretty vital.
Thank you. Does anybody else have any questions they'd like to ask? Oh, I see Alina dropped something.
I have a question. Do you see cellulitis cases in the earlier stages, in stages 0 and 1? Do you see cellulitis in those cases, in stages rather, or is that something that you see more of at the later stages?
It's definitely more common in the later stages, but I've caught it, I mean, very early in patients with stage 1, early stage 2 lymphedema. Sometimes it starts just simply a little red mark. So like I had a patient once who had it was less than the size of a penny of a red mark on her leg, and she was stage 1. And um, because we're working with those patients, sometimes we're the first ones to notice it, or we're the first ones that they mention that to. And then we were able to kind of mark that. And then as that redness began to grow, she was then able to go to the doctor and get it taken care of much earlier in terms of the cellulitis risk factors. But I've seen it in, I don't know that I've ever seen it in like a subclinical technically, but there have been a few of those earlier stages.
If anybody has any questions they want to drop in the chat or unmute, feel free to do so. If not, you have everyone's contact information, and this session will be posted on the Mighty Networks as well. But I just want to talk about NJ Seed. So in our state, we have NJ Seed, or the New Jersey Cancer Education and Early Detection Program. It's run by the Department of Health in collaboration with local agencies and healthcare systems. It provides education and outreach within the community about different types of cancer. They provide free screenings to those that are unemployed, underinsured, uninsured, or face barriers in getting the cancer screenings they need. Currently, they screen for breast, prostate, cervical, or colorectal cancer, and it's offered in all 21 counties throughout our state. And then thank you for attending today's session. Please let us know how we did. I think Evelyn's going to put the evaluation link in the chat, as well as the Mighty Networks link. Please make sure to register. This will be posted. And if you have any questions, you can reach out to Brittany and Marianne on there as well. Yes, please join us next month for genetics and family history. Thanks again to Kessler Rehab for the wonderful presentation. Thank you all for attending.